So, as our Choi Soo-hyung just reported, the coronavirus will be treated and managed like the seasonal flu from now on. For more, we are joined by Dr. Yoo Byung-wook this morning. Good morning.
Good morning. How are you? Thank you for having me.
Good. Thanks for asking. Dr. Yoo, what does the decision mean? I want to start off with. Is COVID-19 more manageable disease now? How fatal is the virus now?
Well, since the 2019, COVID-19 was very new and strained. That's why we don't know how to handle it exactly. But we have an experience, and we are, especially in Korea, we are fully vaccinated. It can be manageable. It's like a seasonal flu. Seasonal flu, the influenza, still the fatal for some risk group, but generally we can handle it and manageable. Also, it's not necessary to the focus about to the monitoring COVID-19 too much, because now we have to go back to the ordinary life before the COVID-19. So overall, the government and the health authority, we thought COVID-19 is a manageable condition in Korea. That's why we are stepped down from the second. It's like a measles and tuberculosis. It's the same as like seasonal influenza in the group 4.
Right, the virus definitely, surely seems to be under control after all the 3 years of struggle that we had.
Correctly. So not only for the health authority and the government, our people who live in Korean Peninsula, we know how to handle it exactly. In the ordinary life, we get used to keep on personal hygiene, and we are precaution about COVID-19. That's why we believe our people can overcome this situation.
Right. The number of newly confirmed cases is on a downward trend, but I still see people getting confirmed, and I myself have yet to get infected after all the 3 years. So now, from now on, starting today, what is the care system like? What kind of help can we or they seek from the government?
Well, first of all, more than 60 years old and the vulnerable risk and the high-risk groups, government still help supporting to the medication and test. But from today, 31st of August, after that, in general, PCR or rapid test, we have to pay it. People, certain region, the doctors supported and have a report. PCR or rapid kit test was free, but from 31st of today, patients have to pay. So depend on the clinic and the small medium-sized of hospital, in general hospital or tertiary referral hospital, the prices can be different. Anyway, we have to pay it. But don't be worried about it. Still, the more than 60 and high-risk groups and vulnerable groups and the medical professional and the hospital worker still undercovered by Korean health insurance and government supported.
So apart from the vaccinations, the prices vary depending on your locations or your clinics or even your occupations and your age.
Correctly.
I also want to raise how the country has a 4-tier system, to cope with infectious disease. That is attention, right, and caution, alert, and serious. Now, why is the country keeping COVID-19 at alert level then?
Well, because we have a double demics. Actually, double demic still ongoing. Why? Usually seasonal influenza is going around in the cold season, winter seasons. But this year, it kind of strange. COVID-19 and the influenza or influenza-like disease is going around in everywhere. So any single time, because now getting colder, and our alert level of the general people are a little easy to going about the influenza and COVID-19. That's why any single time government and our health authority promptly and rapidly response of any the contagious disease. That's why we have to keep that. But generally, people didn't feel that any discomfort about the level of change of the older system.
Right, I am one of those people. So the government keeping COVID-19 at alert level for now, but what would it mean to downgrade from alert to caution? What will that mean in terms of the virus situation here in the country?
So usually under the Ministry of Health and some organization and government, they have took the responsibilities to how to handle it. But this means government, in the higher level of government under the ministers, and the prime minister will hold this whole authority and responsibility, which means if going down a level, so minister of health or other low level of the health authority to take care of the responsible, but which means government in the higher level of the authority will take care of this issue until going down. But anyway, in general life, we didn't feel anything the difference.
All right, Dr. Yoo, thanks so much for your insight this morning. You have a lovely day.
Have a lovely day. Thank you for having me again.